How long have you worked here?
6 years.
And what were you doing before this?
I worked in the bone marrow transplant department.
Here at the University of Minnesota?
Yep.
And where are you from originally?
I'm from California.
What part of California?
Sacramento.
And why are you out in Minnesota?
Family moved all over the place when I was younger, so I lived in California for the first half of my life and then Minnesota for the second. I've gone a little bit back and forth, but I prefer Minnesota.
Even though we're having a winter storm today in the middle of April?
Yeah, it doesn't feel like it as much. That appreciation for the state drops around this period of time when I like winter, but I'm also get to this time when I would like it to be over with as well. So
Sure. Okay. So what do you do here at the university?
I'm a coordinator for the Department of Clinical Coordination.
Okay. And so what do you like best about your job?
I just like working for the department in general. I've worked with different clinics over the years, and one thing that's interesting about working for the neurosurgery department is that you guys, neurosurgeons in our department, don't really take it as much as a career as it is a lifestyle. You guys are here all the time. Like when I get here in the morning, you're here, and when I leave at night, you guys are still either in the middle of a procedure or doing something. And it's weird because it doesn't feel so much as work as it feels like just trying to keep up with you guys and like try to take care of everything. But I mostly like working with the patients. You guys deal with a lot of people who are either frightened or in pain, and typically in my role, you guys do the surgeries, the nurses talk to the patients, but as part of the first line of communication for a lot of patients, we get to kind of clarify a few things just to talk to them, just to make them feel more comfortable with what's going on. Because a lot of times there are important things that you guys are doing that the patients aren't even aware of, and they, being able to communicate to them, yes, we definitely are working with you, and we understand what you're going through. We're trying really hard to do this. If they don't hear that, sometimes they don't think it's happening. And so it's nice to be able to just talk to them and let them know that things are happening. They may not always see it, but they're going on.
So do you remember any patients in particular that were, particularly memorable at all?
Yeah, for different reasons. There's been all sorts of patients. There's a really nice patient of Dr. Haynes who, that she was very complex, has a lot of different issues going on, but she was also very nice, and so she would call and she immediately would recognize my voice and be like, "Oh, Matt, hi," and like when she came once and like she called me down to the clinic to give me a hug, and I'm not a hugger, so it was like, but it was very sweet to know that she cared as much, and like she gave me her son's like graduation photo and everything, and it was cool to know that something I did meant that much to her, that she felt that we were friends more than just just somebody on the other end of the phone. So that's cool.
Absolutely. And patients always ask me, "Where's Song?"
Yeah, exactly. They always ask where you are, and it is nice to put a face to the name, and I do like being able to see the people, but we're all spread all over, so sometimes they don't realize we're not actually there in the clinic. But yeah, you talk to them so often that it's nice to meet them and say hey, and
yeah. No. Nice to know that you're a part of the team.
Yeah, nice to know you're part of the team, and they like to know that who they're talking to sometimes. So it's cool. But yeah.
That's great. Any funny stories about patients?
Trying to think of a good funny one. Sorry, I'm trying to think of a funny one that's clean and not insulting. So like that's
that's okay. So who's the most serious attending neurosurgeon?
I would have to say Dr. Abash, but at the same time, it's also one of those things where she's funny, but she's definitely serious in terms of like, if she feels that you were in a barrier to her patient's progress at all, you better run. You'd better get out of the way because she will let you know. And I mean, all of you guys are kind of like that. I mean, you don't like feeling somebody got in the way of patient progress, or patient care at all. And if there's a barrier, you guys go through it instead of around it. So, but she's not one I would want to cross.
Perfect. That's awesome.